By now, I'm sure most of you have heard about two recent studies that have linked testosterone to heart disease, more specifically, heart attacks, strokes, and blood clots. Like just the other day, I viewed in a span of 30 minutes two different commercials on nationwide television from two different law firms that stated something to the fact that if you or someone you know has had a heart attack or stroke while on testosterone therapy, please contact the law offices of so-and-so for possible punitive damages. Now, if that's not enough, that very night on my Facebook page there was another ad from a law firm, and it stated this, and I quote, "The FDA warns that prescription testosterone drugs increase the risk of stroke, heart attack, and death. We are here to help cardiac arrest victims of testosterone prescription drugs." I'm Dr. Howard Elkin, board-certified cardiologist and anti-aging medical specialist, and I'm here to tell you that these studies are bunk. And that statement that I just read from the FDA, it's totally false. The FDA has stated nothing of the fact, nothing linking testosterone and heart disease to this date. So this is wrong, terribly wrong. So why would I come forward at this time? Because as the medical advocate, I encourage all my patients, my readers, and my audiences to gather all the information they can so that they can get in the driver's seat when it comes to their health. And in turn, they become their own best medical advocate. But I have to tell you, with studies like this and with the law profession and the media capitalizing on it, it can be awfully confusing to separate fact from fiction. That's where I come in. First of all, you need to know that in this country, any physician of any background or training or specialty can prescribe testosterone. Now, we know nothing about the background of these doctors involved with these two studies, nor do we know the training that they underwent. But how many of us have actually undergone a bona fide fellowship in anti-aging medicine and who have subsequently taken the boards in this particularly new specialty? Very few. Those of us that have been awarded this credential know how to properly screen, monitor, and treat these patients on testosterone replacement therapy. But in these two studies, we know nothing about the background of the physicians or the details of their training. But there's more, much more. Over the years, there have been numerous studies that have demonstrated that men with low testosterone levels are actually at increased risk of heart disease. And there have been numerous studies that have shown that being on testosterone replacement therapy can actually help prevent heart disease. And in those that have heart disease, there may even be benefit there. So with this information, you might question, like, why or how could these studies come to fruition? That's where the flaws come in. For the sake of time, I'm just going to name these flaws, but for more information, please look at the blog page on my website at HeartWise.com. The first flaw, estrogen levels were not measured or even mentioned in these studies. The second flaw, red blood cell counts or hemoglobin levels were not mentioned or probably not even measured. The third flaw, in both studies, once men had begun on testosterone therapy, we don't know anything about their levels. Were they right on? Were they subtherapeutic? Or were they higher than we wanted them to be? We don't know that, and that really can make a difference with regard to outcome. And the fourth flaw, DHT, or dihydrotestosterone, which is a breakdown product of testosterone, was also never mentioned. So here we have two studies that are badly flawed, and coupled with the fact that we don't even know the background of the doctors prescribing the therapy, and a retrospective analysis, which in itself can lead to quite a bit of bias. Now, testosterone replacement therapy is an individual choice. And like any therapy, there are potential pitfalls or complications. But in carefully selected individuals, and the therapy being administered by properly trained physicians, these pitfalls or problems really should be circumvented. So please become your own best medical advocate. Gather all the information you can, not just about testosterone, but for any therapy and for any disease. Don't believe all that you read, and certainly don't believe all that you see on television. Because after all, whose body is it? It's your body. So stay in the driver's seat when it comes to your health.